Good morning and welcome to another edition of Medical Minute. My name is Dr. Abiola Ajayi. I'm the MD CEO of ROA Specialist Hospital, and I'm welcoming you to discuss about unusual headaches, blurry vision, dizziness, and when you should worry. Let's get into it. First of all, a little background. Headaches are very common. 50% of all adults worldwide will experience headaches every year. In Nigeria, same statistics, usually due to stress, poor sleep, heat. That we have tension type headaches, and migraines are also very common. But there's some key points that you need to remember. So when a headache is sudden, severe, like something just hits you inside your head, or if it comes with nausea, vomiting, or blurry vision, or if it's new and different, especially if you're above the age of 40, these are all red flags that you need to come and see the doctor. A lot of people will say it's just stress, but not all stress should cause these types of headaches. So it's not just stress, it's a red flag. Let's talk about blurry vision. Blurry vision may come from eye problems, maybe you need glasses or such, but it can also mean that you have increased intracranial pressure, meaning increased pressure inside the brain. It can mean that you're having a stroke. It can mean that you have something else compressing the brain, like a tumor or an aneurysm. It can also stem from high blood pressure, but I don't want people to think that you must have a headache or you must have blurry vision to have high blood pressure. It's known as a silent killer for a reason, but I'll still give you some of the symptoms that you should be aware of. Interesting statistic, in the States, 10% of people or 10% of brain tumors are discovered when the patient goes to see the doctor about blurry vision. That was their only complaint. Eventually, through workup, they now figured out that the patient had a brain tumor. I'm not saying anyone watching this video has a brain tumor, but we have to keep all of these things in mind, especially when we're evaluating you for unusual headaches, dizziness, and blurry vision. So talk a little bit about dizziness. Dizziness is not always, we like to blame it on malaria or I need blood tonic. It's not always like that. We tend to blame dizziness even on typhoid in Nigeria. We like those malaria, typhoid, or spiritual attacks. But medically, dizziness means that you can have one of three things. If you feel like the room is spinning, that's called vertigo. If you feel faint, that's like lightheadedness. Or if you feel unsteady on your feet, which is an imbalance. All three of those can describe dizziness, and all three of them have different causes. Now, when dizziness comes with blurred vision and a headache, that those three can point to brainstem issues. Your brainstem is here. You could point at strokes, whether it's a CVA, which is a big stroke, or it's a TIA, which is a mini stroke, as they say, transient ischemic attack. All of those can be associated with dizziness, headache, as well as blurry vision. You can even have hormonal problems like thyroid, multiple sclerosis, and other neurological diseases that can give you the same kind of symptoms. So I know I've mentioned a lot of scary things like brain tumors and this and that. I'm not here to scare anybody. I just want to educate, and I want the public to know when they should worry, like when you should worry. So let me tell you the list of non-negotiables, things that are red flags, right? If you have a headache that is sudden, you describe it as the worst ever headache you've had of your life, or it keeps getting worse and you're using pain medications, red flag. So the next one is blurred vision. If you have blurred vision that doesn't clear up or comes with pain, if you have dizziness or slurred speech, you feel weak or you've collapsed, and also if a patient or a person exhibits memory loss or confusion, these are all early warning signs that you'll need more help than just running to the chemist and grabbing some painkillers. You know, I like statistics. In the U.S., every 40 seconds, a patient has somebody has a stroke. So these things are important. In Nigeria, about half of the people that have high blood pressure don't even know that they have high blood pressure, or are they doing anything properly about it? So when I move to the next segment, what should you do? Number one, don't self-medicate. Okay, don't go to Google or WebMD and try and figure out your symptoms. If you're having chronic, meaning recurrent or severe headaches, you need to come and get evaluated. If you have high blood pressure, diabetes, or sickle cell anemia, and you develop those symptoms, you need to come quickly to be evaluated. And you'll need to have a doctor that's qualified to give you a proper neurological exam. So meaning we're going to test your cranial nerves, your eyesight, your hearing, even your reflexes, to see if there's anything that we're missing. And if don't see anything clinically, we may order a scan, something like a CT scan or an MRI. Anytime you're in doubt, see your doctor. This is why I do these series. It's just to educate the public. If any of you need help, please send us a message on socials, or you can come and see me in the office. 080-888-62635 is the front desk, and we'll schedule an appointment for you. If you mention this video, you can also qualify for discounted tests and a free consultation with me. So please do your body some good. Don't ignore the symptoms. Don't delay. See you soon. See you next week for the next Medical Minute.